I go for a mammogram every year just because I'm supposed to go do it, but it never occurred to me that I was actually doing it because it might diagnose me with something. It was pretty much a big shock at 42 and absolutely no family history.
We have proven over and over again that mammograms save lives. If you're able to catch breast cancer early, the interventions that you're going to need are going to be less severe in many cases, so that screening is very important.
Because of my age and the stage of my tumor, I was basically given the options of either mastectomy or doing the lumpectomy, followed by 6 weeks of radiation, followed by 5 to 10 years of hormone suppressive therapy. I'm a woman of action, so I decided to go with a mastectomy. And then I was also told there's no way to make them match. You'll be lopsided, so I went with both.
She had a very smooth surgery. She only needed to spend one evening in the hospital.
I was out enjoying time with friends within 8 days of my surgery.
3 months later, we took out the temporary tissue expander, put in her permanent implants, and she's really pleased with where she is right now.
And sometimes she's even told me she's happier with the way she looks now than before her diagnosis.
I look great in a bikini. I have no pain. They got all of the cancerous tissue out of me. So if I had to get cancer, at least I got a nice chest out of it. I happened to find 2 doctors that sort of got my sense of humor, and one of the first things that Dr. Iteld told me is that we're gonna be buddies for the next year. We're a partnership, so if you don't like the doctors you've been referred to, find other doctors. It takes different types of people to, mesh personalities, and you need that when you're going through something really scary.
She's just so positive about what she's been through. She's a true survivor.
Even during rough times, it's okay, and there's that big smile. I think that's what we all love her for.
I've written a blog piece for Advocate Illinois Masonic specifically focusing on my experience with reconstruction so that other women know it's not horrifying. It turns out at the end that you look better than when you started. Hopefully your situation will be just like mine, and 5 months later you'll be able to talk to somebody else and let them know that it's going to be okay.